Good afternoon. Can you hear me? All right. Like she said, I'm Dr. Michael Beard. I'm a family physician. I want to thank Ms. Beverly for having me. And I want to thank all of you for coming out. Again, give yourself a hand for tearing through this weather. And I'm thankful that you all came out. What are we talking about today? We're talking about prostate cancer awareness. First thing is, who knows what a prostate is? Few people. Who knows what's the importance of a prostate? Not a lot of people. So what the prostate, next slide. You got it. So the prostate is it's a gland that is below your bladder. It's right in front of your rectum, and the job of the prostate is to secrete fluid with your semen. So its job is to it nourishes your semen so the semen can reach the cervix and the uterus, and we can reproduce. Anybody in here reproduce? You can say amen to that. So that's the importance of the prostate, right? But next slide. What is prostate cancer? Prostate cancer is when the cells of your prostate begin to grow uncontrollably. When those cells grow uncontrollably, they spread, they kill everything around it. They kill the tissues around your prostate. Then eventually, we call it malignant. It spreads to other organs in your body, and that's when we get to the point where we're dying. All right. The main prostate cancer that we have is called adenocarcinoma. That's the gland. Anything that secretes, we call it adeno. So it secretes a gland and it becomes cancerous and spreads throughout your body. Next slide. Mortality rate. Mortality in medical field, we're talking about death. So 1 in 8 men will be diagnosed with prostate cancer. Right now, 2025, 300,000 men have been diagnosed this year, and we're in June with prostate cancer so far. The good news is if we get screenings early, you have a 99% chance of survival. But if you get screening later and we find it in an advanced stage cancer, that goes from 99% survival to 34% survival. Now, with prostate cancer, we do have some racial disparities. African American men die at a 2 to 3 times rate higher than any other race from prostate cancer. Also, Black African American men, we are behind in getting our screenings. So I'm thankful for this today to just make an awareness that our screenings are so important and it's saving our lives. This is one disease that we do not have to die from. And I'm thankful that so many women are here because, like you said, a lot of men, we want to work, we want to make our money, and we don't want to take that time out to get our screenings. But the women in our lives love us enough to continue to get on our nerves, continue to love on us to get us to their doctor. So I definitely appreciate y'all coming for that. Next slide. So the risk factors, what makes it easier for us to get this disease? First is your age. So once you get 50 and older, the risk for this disease increases over time. Once you get 65 and older, the risk continues to increase. Family history. So if you have one family member, your father, your brother, your cousin, any family member that had prostate cancer or has prostate cancer, your likelihood, you have 2 times more chance to get prostate cancer. So again, we need to talk to our family. We need to talk to Pawpaw. We need to talk to Grandmama. We need to talk to Auntie and figure out what's going on in our family. It's too many times a patient come in and I ask you your family history, and they say, I don't know. What mama got? I don't know. But she died from something. So we really need to talk to each other. We really need to understand what's going on and how we can save our lives. Another risk factor is, again, race. African American men, again, we're dying at an alarming rate from this disease, and we don't have to die. First of all, we need to get our screenings. First of all, we need to talk. And another thing is just our lifestyle factors. What you eat matters. we are what we eat. When we put the wrong thing in our body, our cells change, inflammation happens, and then disease happens. Most diseases you hear about starts from inflammation, starts from something we put in our body years prior. And then, of course, like I said, genetics, family history, those things do happen too. So eating right, physical activity. I know usually you get a little older in age, you don't want to do as much. But hey, 30 minutes a day, a little brisk walk can save your life. Next slide. So how do we diagnose prostate cancer? So what we usually do first, we'll do a lab called a PSA, and we'll look at those levels. If we see that that level is above 4, it's a 25% chance that you have prostate cancer. But usually you want to see that your numbers are 3 or below. So when you go to your doctor, ask for that level. But if you're having even worse symptoms, of course, we need to do the digital rectal exam, which most men don't want to do that, but it's necessary. Again, we're trying to save your life. But once we get to that point where we're thinking you have prostate cancer, we definitely need to do a biopsy. By that time, I send you to a urologist, and they'll take over from there and go on with your treatment. And the next thing is, if we think you have it and we think it spreads, we do CT scans and we do MRIs so we can kind of stage your cancer and we can get along with your treatment. But again, the goal is to prevent this for you so you won't have this. All right, next slide. How do we treat this? So in most races, prostate cancer grows slowly. So it may take 10 to 15 years for some people to actually develop symptoms, for some people to even die from this disease, 10 to 20 years. But again, African American men, when you get this disease, it's a rapid killer for us for some reason, but they're doing studies and we don't know why it's killing us at a rapid rate right now. But again, as I keep saying, let's get our screenings, let's talk to our friends, our brothers, let's get them out so we can prevent this. Other treatments, like I said, we can actively watch it. We can do a prostatectomy, take your whole prostate out. We can do radiation, chemotherapy, and hormone therapy. Next slide. Next slide, we can go on to the prevention. So how do we prevent this? First, like I said earlier, diet. Increasing vegetables in your diet, increasing fruit in your diet, more water, getting away from excess sugar. All these things play a role in growing the cancers in our body. But if we can stay away from sugars and processed food, that can help, decrease the chances of getting this disease. Again, like I said, exercise, physical activity, whatever you can do. Some people, they're not walking too good. Hey, do some exercise in the chair. Get you a water bottle and move your arms. Whatever it takes to get your heart rate up a little bit, let's do that. Let's save ourselves. Again, getting your screenings, no smoking. If you smoke, that right there is a killer. So let's try to decrease that as much as we can. Again, stay away from processed food. All right, next slide. Right. Next slide. There you go. All right, so screening guidelines. So U.S. Preventative Task Force, they recommend starting to get your screenings between 55 and 69 years old, and it's a discussion with your doctor. So they're not saying that it's mandatory to get, but they're recommending that you get it. But again, it's a gap between our most races, just say African American men and white men. White men are getting their screenings more at a quicker rate than black men. So in that time of 55 to 69, a lot of black men opt out of getting that screening. And then by the time they decide at, say, 60 years old, that disease has advanced. And like I said earlier, you have a 34% chance to live if we catch it at an advanced stage. But if we catch it early, you have a 99.7% chance to survive this disease. So again, it's a discussion with you and your doctor, but if you ask this doctor, get your screening as early as possible. And again, American Academy of Family Physicians recommends the same thing as far as screenings. Next slide. Again, the high-risk groups are black men. They actually recommend that black men start their screening between 40 and 45 years old. So that's 10 years before everybody else, because it takes that long for it to grow and get to the advanced stage. So again, if we catch it early, we're getting it earlier and we're dying at a faster rate. So we definitely recommend that you try your best to get your husband in, get your brothers in, and get your screenings, get your nephews in, get your sons in. When they turn 40, let's go and get them in now so it can be second nature that they're getting it checked as much as possible. All right? Amen? All right, all right. So next slide. Those living with prostate cancer, there's resources for them also. We got small groups. We have men mental health groups, and we have treatment teams to help out with that. A lot of men don't like to talk about it, but there are resources to get you to the right place and get you in a group to talk to men that going through the same thing that you may be going through, or somebody in your family been through, or somebody suffering with. So again, we want the screenings, but we also want to build a community to where it's okay to talk about this disease. We have a lot of other cancers, but prostate cancer actually is the second leading cause of death in men behind lung cancer. And it's the second diagnosed cancer in men behind skin cancer. So in conclusion, it's important to get these screenings, but we don't have to die from this disease. If we can get our family on board, thank you guys for coming, because it's so important that we start saving each other and saving our lives. Again, that's the end of my presentation. Do we have any questions? Okay, so two things. One, sometimes there are no symptoms. And then there are symptoms where you have trouble urinating. You're waking up in the middle of the night, urinating 4 or 5 times in the middle of the night. You can get it started, your urination started, but then you never feel like you're fully emptying your bladder. So those are like the telltale signs. But also, at the later stages, you may see blood in your urine. You may see some blood in your semen. You may start having chronic back pain, chronic hip pain, and even some pain in your pelvis. So those are some of the symptoms.